Thinking difficulties or brain fog are common symptoms associated with long COVID and post-viral fatigue. You may experience similar symptoms after other infections, a minor head injury, or during the menopause. Brain fog is also common if you have depression, anxiety, or stress. Brain fog is an everyday term for what doctors call cognitive impairment. This means there is a problem with normal mental functioning that inhibits your ability to think clearly, use your memory, or be able to plan activities or recall familiar words and phrases. Symptoms can fluctuate in severity and will often reduce your physical energy. Impaired mental activity requires careful management, and there are currently no effective drug treatments available. However, simple self-help coping strategies can be useful. One symptom that you may experience if you have brain fog is lapses in short-term or working memory. This includes forgetting information which has passed through your brain in the last few seconds, minutes, or hours. Forgetting things is normal in everyday life. For example, when you walk into a room and forget your reason for going there, or not being able to remember if you've unplugged the iron or turned off the television. Long-term and mid-term memories appear not to be affected in the same way. Brain fog can also result in difficulty processing information or retrieving stored information. Examples include struggling to find the right word to express yourself or mixing up commonly used words. You may have difficulty carrying out everyday tasks that involve sustained mental activity or having problems with multitasking. Symptoms may be variable and fluctuate according to how you feel. Research into brain and neurological problems is ongoing, but this is what we think may be the possible causes of brain fog. The normal immune response to infection is inflammation, which may cause scarring in the brain, leaks in the brain barrier, allowing blood substances to enter into the brain and nervous system, and causing further inflammation, ongoing irritation to the nervous system. Inflammation in your brain hinders the ability of your brain cells to communicate with each other. This may be one of the factors that contributes to brain fog or mental fatigue. Inflammation, bruising, and scarring in the brain can recover over time, just as in other parts of the body. Fatigue, anxiety, breathlessness, and not eating and drinking enough can also contribute towards cognitive problems. Some of the activities that can contribute towards brain fog include watching screens, reading, conversations, listening to the radio, planning an event, playing word games, and gaming in general. If brain fog is causing you difficulties with your work and home life, here are some techniques that may help you. Effective pacing is key. Try to understand which activities are most likely to worsen your symptoms and tackle them in manageable chunks. Reduce distractions such as background noise, mobile phones, the radio, and other people in the house. Disable notifications popping up on your screen. Switch off instant chat functions such as Skype and Teams, and spend periods of your day where your mobile is switched off or in another room. Try to focus on one activity at a time. Don't jump around between tasks. And use a diary or write lists to manage your work or home life. Set a clear agenda for what you plan to do for each session of work and try to vary your tasks so that you can intersperse demanding tasks with easier ones.